Hey guys, Dr. Jason here, chiropractor at Limitless Chiropractic. We're going to talk about the ugly truth about arthritis, okay? Favorite topic of mine. Love when we have patients that come in, get x-rays of the spine, look at those x-rays and their immediate response is, oh, you know, it's just my age, or it's just, I've been told I have arthritis as soon as I hit 40, and it's always a topic that, you know, makes me chuckle a little bit because it's silly when you really look at it, you know? If you really have some arthritis, some osteoarthritis, right? That's what we're going to be talking about, is degenerative joint disease, degenerative disc disease, okay? If you really have that through here, and you can see it on x-rays, pictures are worth 1,000 words, right? So when you start to see that degeneration, okay, if you have it between C5 and C6, but nowhere else in the spine, how would that make sense that age is the determining factor for your arthritis? It's not possible. Your entire spine, there's not one vertebrae that's any older than the rest of them. None. So if age was truly the factor, your whole spine would be degenerated the same exact measure all the way through. But age isn't a measure, right? So now let's get to what it actually is, right? So when the vertebrae misaligns or subluxates, that we've talked about the past couple weeks, okay, that nerve is irritated, right? And we talk about DJD, DDD, osteoarthritis as autoimmune, right? What does autoimmune mean? Autoimmune means the body attacking itself. But I'll pose a question to you. The body, yes, it attacks itself, but why is it attacking itself? Can we also phrase it as maybe the body's protecting itself? If the body feels that they have to do something to keep you alive, the body's gonna do it. Your body is, we only use 20% of our brain, I think is the metric that's going on right now. The other 80% will keep you alive. It'll raise your heart rate if it needs to, lower it, and those kind of things. So if your body feels that it needs to fuse these two vertebrae together because of the degeneration that's affecting that disc, then your body's gonna do it, right? So what's the solution for that? How do we stop that arthritis? And what is arthritis? Arthritis is simple. It's the lack of movement in a joint space over time. That's what causes the wear and tear. So you'll hear wear and tear often, but why? It's the lack of proper movement in that joint space over time causes that disc, which the disc doesn't heal through blood like the rest of the body, it heals through movement, right? Fluid exchange. So when that's not moving, it's degenerating. When that's degenerating, it's starting to affect that nerve even further. And when that nerve starts to be affected, that's where the autoimmune part comes in. And your body does not, your nervous system is the most important thing in your body, bar none. So your body will always, always, always protect the nerve because that's how the body functions. Once that nerve is cut off, you lose function, whatever that is. So guys, I hope that was really helpful. One of my favorite topics to talk about. If you have any questions, please reach out to us. We'll see you next week.